I commissioned a needs assessment of Black Londoners to ascertain their HIV prevention needs with a view to those findings informing a wider service, which I'm in the process of designing right now. And I think that when I commissioned the survey, I was kind of ready that I wouldn't get any surprises. And surprisingly, I didn't get any surprises. I think, for the purpose of this, I did pull out 3, which I think are very important. And they do kind of link to what Florence was saying previously. And first of all is around barriers to access and service gaps and lower levels of knowledge in Black communities around prevention methods. So we know that HIV, the stigma generally, taboos around sex and sexuality persist within our communities, but those are exacerbated by the racism that we just spoke about. Digital exclusion plays a huge part as well. So we need to make sure that prevention, that access to testing and treatment is culturally appropriate, is in places where people can access it. But I also throw down the challenge that we also have to increase people's awareness, not just of prevention, but the fact that HIV is an issue in our community. We know, for example, that Black women need to have better access and information about PrEP, but there are significant numbers of Black women and people in the Black community that don't think they're at risk and therefore won't benefit from PrEP, so therefore advocates for it. So the work that we have to do is not only increase awareness and improve services, we have to increase our community's understanding that HIV continues to be an issue for us. The second one is trying to ensure that we have culturally tailored interventions. So making sure that the stuff is by us and for us, speaks in a language that we understand, is culturally appropriate, and delivered in settings that we go to. So faith-based settings, community spaces, barbershops, nail shops, Black businesses. I'm a big advocate for trying to make sure that we have work in spaces where young Black women go for brunch. Yeah. That's where we work, right? Where people are. And the final one is about co-production and community engagement.